There are many ways of dying, but only rarely is dying easy. Most of us now will end our lives in hospitals, a few lucky ones in hospices, in the care of strangers, all too often with little dignity and no autonomy. Suicide is legal, but somewhat paradoxically, it is against the law to help someone to die. Unassisted methods, of course, are very distressing, both for ourselves and for our families. And that's why in several countries, in Europe, in Canada, in various states, in both America and Australia, an assisted death is legal, but subject to very strong safeguards. Legal assisted dying applies only to people who have mental capacity, making their own free choice, but it is time for their life to end in peace. Assisted dying is about freedom of choice and patient autonomy. It is not, as some of its opponents seem to claim, a license for doctors to kill patients. Assisted dying should be seen as being complementary to terminal care and not in opposition to it. At the moment in the United Kingdom, it is impossible for doctors to have honest and open discussions with their patients about how they'd prefer their lives to end. In my own experience as a doctor for many years, people are rarely afraid of death itself. Instead, they're afraid of the loneliness, the loss of dignity, and the loss of autonomy that so often comes of our final illness. But this shouldn't happen in a civilized society, which is why I support legal, safe, and compassionate assisted dying for the terminally ill and the incurably suffering. And that's why I'm a patron of My Death and My Decision. And if you agree with what I've said and want to do something about it, you should join My Death, My Decision. And we can all campaign together to try to make the law in this land more civilized and more humane.